What's interesting is there is a dazzling array of technologies that are making progress now, in part because the worlds of engineering and physics are colliding with the life sciences, and therefore we're really seeing an enabling of a technology revolution of the kind we haven't seen in medicine in many, many generations. It's just beginning. The essential enabler of this, I argue, is the arrival of a smart grid for medicine that would combine electronic patient records with the smart information technology systems that are needed to make sense of all that medical data so we can improve the care of patients, but we can also improve drug discovery and research.
Would it be fair to say that this is information, broadly speaking, healthcare and information technology meeting?
You're absolutely right. Medicine is in fact becoming an information science or an information industry. This has happened, of course, to many other industries where over the last 20 years the tools of IT has helped really weed out the champions from the weak companies and produce new kinds of business models with great benefits for consumers. I see the same sort of change coming with tweaks to adjust for the fact that medicine is, of course, not an industry in its strictest sense. Dramatic changes are coming to medicine because it's becoming more of an information business.
Now, reading your report, I get the impression that medicine might be somewhat behind other industries in this. There's an excellent anecdote that one of your characters, Drew Greenblatt, relates. His receptionists, his shipping clerks, and even industrial robots at his company use email. So he wonders, when will his doctor learn to use email as well? Is there some catch-up that medicine has to do on this front?
Absolutely, and this is most striking in the United States, which of course is the wealthiest and most technologically advanced country. It's a country where we spend 16% of the GDP on healthcare, but at the very rudimentary level of things that matter, that is connecting patients to doctors, connecting patient information to both patients and doctors in a useful way. Recent studies have shown that very few doctors and hospitals actually use these enabling technologies that are made possible from the IT revolution.
What is it going to look like once they start to?
I think this will have a powerful catalytic effect, not just on the simple things like for a patient to know, for example, what are his or her test results, or to be able to have all in one place and in portable fashion all of one's medical records. So when someone travels and something happens when one is away from the paper records that are the norm in many places in the world, to actually get the kind of normal care you'd expect. But the beauty is, once we set up a smart grid for medicine, it is an essential enabler of many other things. Drugs researchers can harvest this information, with privacy protected, of course, in a way that can make the most of the genomics revolution, which is another one of those important changes that's happening in our lifetimes. The decoding of the human genome is making it possible to understand the true nature of disease and to develop treatments that are more precise and more personalized. But in order to do that, we need to really appreciate and understand the existing knowledge of all the patients, which is currently locked away in file cabinets in pencil and paper.